Hello viewers, today going to discuss some time about polycystic ovarian disease, otherwise called polycystic ovarian syndrome or shortly known as PCOS or PCOD. There are many misconceptions about this condition. At the same time, there is a lot of ignorance as well about this condition. Various studies have shown that about 2 to 25 out of 100 adult women do suffer from this condition called PCOS or PCOD. Then let's go into the actual details about what constitutes PCOS or PCOD. PCOS or PCOD is something which has at least two of the three that I'm going to tell over the next few minutes. The first one is that an individual with PCOS usually has appearances of polycystic ovarian syndrome on their ultrasound scan done related to their ovaries, and I will discuss this in a bit more detail after some time. The second feature that is present in these people is what we call as oligomenorrhea, that means irregular and less frequent menstrual periods. The third feature being that these people have features of what we describe as hyperandrogenism in medical terms. Again, I'll be discussing about this in a bit more detail as the video progresses. But in crisp, people with polycystic ovarian syndrome or polycystic ovarian disease have two of these three features, i.e. polycystic ovarian syndrome appearances on ultrasound scan of the ovaries. Second being that these people have less frequent or irregular periods. The third feature being that they have what we describe as hyperandrogenism. Then let's look into a bit more detail about all these three features. Coming to the first feature, it means ultrasound appearances. These people with polycystic ovarian syndrome or polycystic ovarian disease do have slightly large ovaries on ultrasound scans. Also, they do have more number of follicles on ultrasound scan. What are these follicles? These follicles are nothing but small cystic bubble-like spaces within ovaries which constitutes the egg. So there are a lot of these follicles in number. Also, the ovarian size is increased if they do an ultrasound scan in these women who have polycystic ovarian syndrome. But I wish to remind you that not every individual who has these appearances of polycystic ovarian syndrome or polycystic ovarian disease and has bulky ovaries or excess number of follicles on a routine ultrasound scan has necessarily got polycystic ovarian syndrome or polycystic ovarian disease. The second feature is about what I told you, that is irregular menses or oligomenorrhea in medical terms. Most of these women with polycystic ovarian syndrome has irregular menstrual cycles. Sometimes they have cycles which come once every 2 months, 3 months or even less frequently. Some of them have delayed irregular periods only. Some of them may not even have periods for up to 6 months. So this is what we describe as oligomenorrhea in our medical terminology. Coming to the third feature, these people have what we describe as hyperandrogenism. Hyperandrogenism in simple terminology means excess testosterone or excess testosterone like hormones in the blood. It presents in the form of acne, that means pimples. It does not necessarily mean that every woman who has acne necessarily has PCOS, but acne happens to be one of the sign or feature in people who have polycystic ovarian syndrome. Also, because of this excess testosterone hormone in the blood, they have greasy face. Again, not everyone with greasy face necessarily has polycystic ovarian syndrome. They also has excess facial hair or bodily hair, which we describe as hirsutism in medical terms. Also, these people may have loss of or thinning of their hair on their scalp. So these features together constitute what we describe as hyperandrogenism, and some of these people have some of these features. Some of them don't have all the features but have only a few of these features. So essentially, if anyone has these features, that means excess acne, greasy skin, also what I told you about the thinning of the hair on the scalp, and if they have excess facial or bodily hair, then they might as well have polycystic ovarian syndrome. If they do have any of the two other features that I mentioned, which is oligomenorrhea, that means irregular, less frequent menses, or polycystic ovarian syndrome like appearances on ultrasound scan. So coming to the next aspect, what exactly causes this polycystic ovarian syndrome or polycystic ovarian disease? The cause of polycystic ovarian syndrome or disease is usually genetic. That means this runs in families. If mother has, grandmother has, then there is a higher chance that a particular woman might herself have this condition. Also, it is important to remember that women who are overweight has a higher chance of developing this condition, although there is a rare variant called lean PCOS. That means the individual's body weight is not necessarily very high, but they still have polycystic ovarian syndrome. But usually, most women with polycystic ovarian syndrome are in fact overweight or obese. Then, if we move on from this, how do we evaluate a person when they come to our clinics saying that they have irregular periods and a bit of excess facial hair, a bit of acne, and also possibly sometimes they even come with ultrasound scan reports done by general physicians or their gynecologists or others elsewhere. We first take a good detailed history and try to find out when the period started, when they became irregular or they're regular, whether the person suffers from fertility issues, etc., etc. We also try to examine them, looking for this excess facial hair, acne, and also other features of loss of scalp hair, etc. We also look for any tests which have already been done, and if they haven't been done, we do check for testosterone hormone. We also sometimes check FSH, LH, and estrogen hormones, which are female hormones, and we also evaluate the individual for other conditions which can mimic polycystic ovarian syndrome, such as congenital adrenal hyperplasia, and check for a hormone called 17-OHP. This might sound a bit too scientific for you guys, but this is what we do in our endocrine, i.e. hormone clinics. We also check for blood glucose levels because they are obese and they are predisposed to type 2 diabetes mellitus, or in simple words, excess blood glucose levels in their body. We also evaluate these individuals for their lipid profile because these individuals might have bad lipid profile or excess LDL, which is bad cholesterol, and excess triglycerides, which is another bad cholesterol. So in essence, we check for all these blood parameters. Sometimes we also do other tests such as prolactin hormone. We also sometimes check for other hormones such as DHEAS, as may be necessary in a particular individual's case, but not necessarily in all cases. Sometimes we also evaluate for some rare conditions such as Cushing syndrome, acromegaly, etc., but not necessarily in each case that comes to our clinic. Then we do put these results, the history, and of course the patient's appearances, along with the other parameters that we have assessed, and try to find out if this person has polycystic ovarian syndrome based on all the description that I have given to you.